The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good day to you, whatever time of day it is. For me, it is 11 a.m. on January the 2nd, 2024. Happy New Year, and I wish everyone who is viewing this episode of TMD Demystified a very happy and successful new year for you, your family, and your practice. I look forward to this year and developing continued episodes of TMD Demystified. As you know, my name is Tony Urbanic. Today's topic episode will be titled Value-Based TMD TMJ Treatment. Value-Based TMD TMJ Treatment. And I put a lot of thought into this over our holiday. I was fortunate enough to have 10 days off between the Christmas and the New Year holiday. And I don't know if that's good or bad. If you put me aside and let me think too much, you never know what I might come up with. But I also got the chance to catch up on some reading that I had been meaning to do, that I had started and I had put aside, but I was able to do some reading I wanted to investigate. And from that came what is going to develop here into a series of episodes for TMD Demystified, all based on this topic, value-based TMD TMJ treatment. Now, for anyone who has followed these episodes, and I believe this episode is number 132. I've been doing these for better than 2 years now. You well know that I tend to call things like I see them, and I'm not afraid to speak up when I see the inappropriate kinds of things that go on regarding the understanding or treatment or dissemination of what we call TMJ. So everybody calls TMJ. Now, there's a lot of it. There is a lot of it. And it is my mission personally, and the mission of our company, TMJ Services, to dispel all of the nonsense and fiction and inappropriate treatment and inappropriate understanding about this process. I've been working on this problem all of my career, as you know. I started out with 36 years of temporomandibular joint surgery. And again, I'm sure that you know by now that 12 years ago, I put down the scalpel regarding TMJ surgery, decided to see if I could really figure out what was going on with this problem, and I did. And that is contained in multiple episodes. I won't go through that again. But along the line, I ended up going down this rabbit hole. I did not know there was a rabbit hole. I just wanted to see if I could solve a problem that I knew there was no answer for. There was no solution for TMD because no one understood the problem. In fact, that can be validated in many different ways, but let me just validate it this way. In 2018, I attended the consensus study that was called at the National Academies of Science, Engineering, and Medicine in Washington, D.C., and I attended that 3-day meeting. I can talk about, and I already have talked about this meeting. I actually did a 7-minute presentation on my findings and what I had discovered regarding TMD at that meeting. And for anyone who would like a copy or link to that video, if you contact me, I'll be happy to send you a link to that video at the consensus meeting. And this book that I held up is the consensus report. It's online, and they also published it in book form, and I bought a copy of that. And I was able to present my quote discoveries, because I didn't discover anything. All I found was information that has already been in the literature, connected the dots, and actually found that all of the symptoms associated with TMD are driven directly by inflammation within the temporomandibular joint. So here we have a recent publication that was called in Washington, D.C. at the National Academies of Science, Engineering, and Medicine, with this express purpose of trying to encourage and figure out what the problem was with understanding TMD. An entire book was generated from this. And basically, what this says is that there's a lot of information here, but there is no solution to TMD. That's what we're looking for. So they have a whole volume of data. The ultimate response is, here's some data. This is what we think is going on. This is data associated with the temporomandibular joint. Here's a bunch of studies that have tried to prove one thing or another, but ultimately we don't know what's going on. We don't know the solution. Honestly, I cannot figure out why the professions, and I say professions, I mean dental profession, medical profession, and academic professions, cannot get their arms around the simplicity, because it's in the literature. If you read the literature, you know where to look, how inflammation, in a joint will create muscle trismus that controls that joint, therefore pulling on the bone, therefore causing symptoms. And those symptoms, when it applies to this temporomandibular joint, those symptoms which are created are headache, earache, jaw pain, neck pain, tinnitus, subjective hearing loss and vertigo, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various kinds of jaw locking. But apparently they can't, because after my very simple and direct presentation, basically not begging, but asking the attendees, very smart people, very, very smart people sitting around the table at that meeting. I was an observer. I wasn't a participant at the meeting. I just observed and was given an opportunity to speak. After their published volume came out, just the concept of inflammation within a joint can create trismus and symptoms. It's not connected in this volume. It is not given the light of day. And that proves my point, which is my point, and why I started 12 years ago to try to figure it out. Is like, no one knows and admits they don't know what's going on with this problem called TMJ. So now that it is there to look at, and I encourage anyone who wants to look at the data that has been in the literature, that was developed inductively, inductive reasoning, not deductive reasoning, inductive reasoning being my patients gave me a clue, a direction where to look. If I put my finger between my front teeth, it feels better. I looked there, it worked. Then I had to figure out how it worked, which is quite simple. It's in the literature. So now we know that there is a solution. It works really well. We have an independent study from Middle Tennessee State University, which goes over the details based on successful treatment of over 3,000 people. And now we're up against the professions that their fixed idea is that nothing really works. We're still looking for a solution. And what is proposed treatment for temporomandibular joint symptoms, and that's all that's out there, is everybody who's trying to just treat symptoms and not the root cause. Everyone's trying to treat symptoms, not the root cause. Root cause being inflammation within the temporomandibular joint. So it gets down to the fact that I'm kind of boxed in to speak on one way or another the other kinds of treatment that are not effective, that people are wasting their time and money on, and not treating the root cause. And so from a practical point of view, and I am a very practical person, from a practical point of view, it's all about what are you doing and what value does it have? What's the value of what you do, doctor? And I assume everyone, or just about everyone who watches or listens to these episodes is a dentist of some kind. What's the value that you put into what you do, whether it's a teaching position or a private practice position, or you're a member of a group? What is the value that you add to that practice or position? And in this case, I am focused on temporomandibular joint problems. But along those lines, as I started out by saying, I am very interested in investigating healthcare in general as it applies to TMD, because basically TMD is a major healthcare problem, totally misunderstood, validated by this heavy volume here, which basically says we don't know what's going on. And that needs to be addressed in a general way regarding healthcare, and then focused down to the specific of TMD. So along that lines, if you follow my reasoning now, I spent the 10-day holiday catching up on some reading, and I had been aware of a couple books that I wanted to read in healthcare general, and to see how that might apply to TMD and the treatment of TMD and the understanding of TMD and the development of a proper treatment for TMD in a specific way. Start out with the generalities in healthcare and to see if that can be coned down into an appropriate treatment for TMD. So along those lines, I had ran across an author quite some time ago by the name of Robert Pearl, MD. Dr. Pearl is a board-certified plastic and reconstructive surgeon, plastic surgeon, trained at Stanford, I believe, and has all the credentials, but one of his claims to fame, and he is an opinion leader in medicine, is that he was the CEO of Kaiser Permanente, which is one of the largest healthcare groups in the country, primarily focused on the west end of the country. But he, for I believe it was about 9 years, was CEO of Kaiser Permanente and was the leader of thousands of staff members, and I believe, if I recall from what I read his bio, 10,000 physicians. And he was the CEO of this physician hospital group. Therefore, he has significant credibility in the healthcare system. And he has written a couple textbooks and does a blog on a semi-monthly, every 2 weeks, bi-weekly, I guess, basis that I'd recommend for anyone interested in healthcare in a general way, which I think we all should be, because we all at one point or another need healthcare, would read his information. But I spent the last 2 weeks, last 10 days, going through both of his books, and I'm going to talk about them generally and then hone down into what we can take away from healthcare in general and the musings, information that has been generated by Dr. Pearl. Dr. Pearl's first book is called Mistreated. And Dr. Pearl has a lot of guts, because he calls things like it is. He is not afraid to observe the obvious. And I've talked about observing the obvious before on this podcast. That is a previous episode. And I mentioned observing the obvious in my own blog, which I write weekly, which is directed primarily to patients. My blog weekly is directed to patients. The podcast that you're listening to is directed to doctors. But Dr. Pearl wrote his first book entitled Mistreated: Why We Think We're Getting Good Health Care and Why We're Usually Wrong. And I'd recommend this book to anyone because he calls things like they are. I mean, he describes, as I went through my medical training and internship residency, and then into spending the majority of my time in hospitals and hospital operating rooms doing major facial reconstructions and surgeries of multiple kinds. I totally agree with his evaluation of the medical industry. So I read that book first, and then that book came out in 2017. In 2021, he had a follow-up book, which was not similar in nature. It kind of took a little different turn, but it was entitled Uncaring: How the Culture of Medicine Kills Doctors and Patients. Now, this is written from the viewpoint of a man who was the CEO of one of the largest healthcare systems in the United States of America. So you have to give him credibility. He's not blowing smoke. And then he also does a bi-weekly blog, which is directed primarily to public. And one of his recent blog articles was entitled Value-Based Healthcare. And that's why I entitled this episode and following episodes in the series that I plan on doing as value-based TMD, TMJ care or treatment. Because he laid out what was really going on in healthcare in general, that is physicians, hospitals, insurance companies, big pharma, and he lays it out accurately as to the problem and the conflicts and the viewpoints that everyone is focused on their own viewpoint and unwilling to change their viewpoint or accommodate, at least to some degree, another viewpoint, and he lays it out perfectly. Now, what I want to really get across, this is an important feature. This is a really important point, and why I'm doing this and why I'm spending so much time doing this. It is generally well accepted that whatever happens in medicine is going to follow in dentistry, is going to occur in dentistry about 10 years later. And I've heard that, and I've experienced that myself, and I've heard others say that. And I can tell you that in my 46 or maybe now 47-year career in medicine and dentistry, having both degrees and academic credentials also, I have experienced that whatever happens, whatever direction medicine is taking as far as patient care and the support or lack of support by insurance companies or the government, whatever happens in medicine, dentistry is not far behind, usually about 10 years. A good example is how our medical colleagues, my medical colleagues, have been all placed in large organizations now, one way or another, hospital organizations or independent medical groups. And you can hardly find an independent physician who has his own practice anymore. I imagine some exist one place or another, but it does not happen. It has not happened. And that began the downward slide on that in the early 2000s and then picked up steam. And now 23 years later, you cannot find a physician who is totally independent. That same thing is happening in dentistry as we speak. 80% of my dental colleagues are independent doctors, and 20% are one way or another affiliated with a dental service organization. And those numbers are going to trip over or invert totally within the next 5 to 10 years, certainly within 10 years, maybe as soon as 5 years, where 80% of the dentists and dental specialists are going to be associated with dental service organizations, and only 20%, if that, will hold independent practices. That's happening now, roughly 10 to 15 years after it happened in medicine. So, I mean, these are the facts. And Dr. Pearl, MD, spells it all out and talks about why it happened, how it happened, who are the major players in the medical industry, and similar to the major players in the dental industry. And he, in his blog, getting back to the point, talked about the solution. The solution for all of this is something that he called value-based healthcare, and then defined value-based healthcare, and then began to dissect or explain, unpack, as they say, what value-based healthcare is. So I don't want to be accused of plagiarism in any way, shape, or form. I can't say that I totally agree with every specific point that Dr. Pearl makes. That would be kind of unusual, I guess. But I do find what he has to teach and what he speaks on almost exclusively is valid and tracks with what I observed over the past 40-some years of my career. And I want to examine this same issue as it applies to one specific disease that we call TMD, TMJ. And that is my purpose. So the title, and this is just an introduction to what will be a series of episodes going forward. I won't claim exactly how many episodes, but I'm guessing that they're probably going to be maybe 8 or 10. We'll see how it goes. Separate episodes on this, which is going to dissect and unpack what should be and what should be qualified as value-based TMD, TMJ treatment, because what we have out there right now has no value base to it. And I've already spoken on this. I certainly don't mention people's names or call out individuals. I won't do that, but I certainly will call out treatment types and things, and I have, and that can be addressed in prior episodes. that aren't treating the basic problem, aren't treating the root cause, and just trying to treat or cover up, literally cover up symptoms. And that's not the way to do medicine. And TMD is a medical problem, by the way. I've discussed that. In my 36 years of doing TMJ surgery over 2,000 times, if it had any kind of financial support from government or insurance companies, it was always considered a medical problem. It was not considered a dental problem. It had no business being covered by dental insurance. Dental insurance, if you put a claim into some dental insurance company or to the Medicare under dental, they would just send it back to you. This is not dental, this is medical, right? So now that we know what the root cause is, which is inflammation within the temporomandibular joint causing all these disparate symptoms that we know as the symptom complex of TMD, you're not going to call it dental now, it's medical. And it is a major medical problem that is frequently, like constantly, not more than frequently, like constantly, more often than not, confused with migraine headaches, Meniere's disease, and ear infections by the medical profession. I've spoken on that in previous episodes significantly, droned on too long about it. So we are going to use this as an introductory episode to discuss value-based TMD, TMJ treatment. So what is TMD? What is value-based healthcare? So according to Dr. Pearl, value-based healthcare is defined as having three parts. First, excellent clinical quality, meaning the technical part of fixing the problem, convenient access, and affordability for all. And I look forward to the episode that we were going to talk about affordability to all, where Dr. Pearl, and I give him all the credit. Again, I'm not plagiarizing anything. I'll give him every credit for this, except as it focuses on one disease, temporomandibular joint disease disorder, TMJ, that the affordability of this comes down to, is healthcare, is it a right or is it earned? Is our healthcare system a right, like a constitutional right of people, or is it an earned service, paid for individually, in this case by the company? And that's a whole other issue that he goes into. Obviously, he is fearless. He's fearless when he attacks this, and I appreciate that. So again, he says value-based healthcare as having three parts: excellent clinical quality, convenient access, and affordability for all. He further states that portions of our healthcare system succeed in supplying two of the three, but never all three simultaneously. And so if you are going to have value-based treatment, in this case, again, I want to focus just on TMD, TMJ. That's all I do here. This is my mission. This is my purpose. We figured out the root cause. We have to promote this to the point where it's actually understood across all of the professions. We have to crank in the concept of the value of what we're doing, as opposed to things that have less value or maybe no value when it comes to treating TMD. And I think my opinion is there's a lot of things being done in the name of treating TMD that have no value at all. So this is the introduction. The plan is to dissect value-based TMD, TMJ treatment. The first part, excellent clinical quality, can be further subdivided into 6 segments, and they will be addressed in additional episodes. And these episodes will be entitled Excellent Clinical Quality, Having a High Degree of Documented Successful Clinical Results. Documented meaning analyzed statistically and eventually peer-reviewed by peer-reviewed analytical statistical doctors. Secondly, simple and transparency of treatment, simplicity and transparency of treatment, treatment with excellent patient compliance, because we all know that if you have treatment but the patients are not willing or able to comply, it cannot possibly be quality treatment. Quality treatment having minimal side effects and unintended consequences. It is important to whatever treatment you do not to have significant unintended consequences and side effects. Fifth, sincere and effective provider or caregiver service delivery. So having quality treatment for TMD needs to be provided by those with sincere and effective service delivery. And then sixth, any communication between provider and patient, which is available, understandable, and adequate. In other words, having proper communication between the provider or doctor and the patient so that the patient understands, is understandable, that the communication is available, and the communication is adequate for the purposes at hand. And that just covers part 1 of the 3 parts of a value-based treatment, which is excellent clinical quality. And then convenience, I think will be a shorter segment. We'll be talking about what he talks about in his books and his own blog, and that is the more frequent use of what we call telemedicine, or in dentistry, teledentistry, making what we do more convenient to the patient, because convenience, whether we as professionals like it or not, as doctors, I have to admit, and I hope that sooner or later others viewing this, or others with their own viewpoint, come to the realization that as medical dental providers, it is our responsibility to make what we do as a service as convenient as possible to our patients. And up until now, and I consider myself going through the golden age, what I call the golden age of medicine, where, as a young doctor, basically as a young doctor surgeon, we could do what we wanted, we could charge what we wanted, we did the surgery that we wanted to do, and no one even questioned us. And that was, in certain terms, the golden age. But was that correct? No, it wasn't necessarily correct. It wasn't the right thing to do. And with regard to relationships with patients, we're here to serve patients. And so part of that must be attention on making what our service is as convenient as possible to the patient. And we'll talk about that in detail, again, stimulated by what Dr. Pearl has to say about his experience leading one of the largest healthcare systems in the United States of America. And then the last portion being the affordability for all. And as you well know, if you follow me and the blog and our company, This service that we offer is a cash-only service because it has been denied by medical insurance to have coverage at all. There is no CPT code for what I do for our device and protocol. I talked on an earlier episode, I don't remember which one, but it's out there, going to the wrestling mat with Blue Cross Blue Shield years ago, 7 or 8, 9 years ago now. And they made it very, very clear that non-surgical TMD treatment with a oral device was not going to have a CPT code as far as they were concerned, even though it is qualified and only as a medical service. So that's how it came out to be a cash-only service. But it is important to understand that our services need to be available to all. Not all people can afford everything that we have to offer, obviously. A lot of people can't afford dental implants. A lot of people can't even afford a denture. But it is our responsibility to make our services as affordable as possible. And I have a lot to say about that, how we handle that in our practice, trying to make what we do as a cash service as affordable as possible. And I'll have an episode on that. So with that as a preamble, as an introduction to value-based TMD, TMJ treatment, that's what you have to look forward to. Maybe you're not looking forward to any of that, and that's okay too. It's okay with me. But after taking my time to read Dr. Robert Pearl's information and what he has to say about healthcare in general, and knowing that dentistry follows medicine for sure as it rolls out in the public's eye and how it's operated, we as dentists need to pay attention and use the information that's out there so that we can apply that for our own practices, for our own well-being. Remember the second book he talks about, it's really well written, how the culture of medicine kills doctors and patients because physicians are being burned out, and it's the euphemism that's usually called. And I am well familiar with the burned out dentist being burned out. Dentistry is a hard profession. I think dentistry is a more difficult profession than medicine because it's very physical in addition to being, there's mental burnout and physical burnout, and then the combination of both. But whether you're standing next to the chair flipping out wisdom teeth with a surgical drill or you're bent over a chair, I know so many of my colleagues going back many, many years. Obviously, I am in a position I can look back many, many years, who have really worn out their necks and their backs and have significant medical problems because of the time they spent bending over a chair and a patient. Very difficult profession, very difficult. So we're going to be talking about value-based TMD, TMJ. That's what you can look forward to. If you would like to learn more about how to actually treat TMJ, TMD successfully, with high success rates, using value-based treatment, you can get more information from our website, which is www.urbanictmj.com. I am open to communication and criticism or comments, good or bad, at my email address, tony@tmjservices.net. Our Director of Operations, Dr. Naomi, will be happy to communicate with you about technical aspects of joining our network of providers who is growing. We just added a couple network providers over the holidays throughout the United States, and that is certainly encouraging us. We have beginning to get questions and interest from international doctors. But I would encourage anyone who'd like to join our network to get more information off our website or ask us, and we can send you copies of the Independent University study showing that the value, talk about value-based, the value of this device and protocol when used properly with patients. With that being said, I'd like to wrap it up. I encourage you to look at our next episode, which will be next Tuesday morning, and we already know what it's going to be about. With that being said, I am Tony Urbanic, and this is TMD Demystified.